Are you looking for a career change? In this video, I'm going to tell you about how to get trained as a medical biller and coder online and how it could totally change your life. I'm Victoria Mole. I'm a medical coder, auditor, educator, and content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. Not a lot of people know this, but medical coding is actually a great career if you're looking for a lot of growth potential. There are a lot of different things you can do with medical billing and coding training, and it's so easy now to learn all of this online. So if you're interested in a career change and you're thinking about medical billing and coding and you don't want to go back to a physical classroom, stick around because I'm going to tell you all of my best tips and tricks. And you should also definitely check out my masterclass. You can find the link in the description right here below where you're going to give that thumbs up on this video. It's going to give you that complete blueprint, that roadmap of how you go from I'm thinking about getting into medical billing and coding into how you become trained and job ready in as little as 6 months without going into student loan debt. And covers all the questions that are probably already on your mind, like salary expectations, and then can give you the information about everything you need, like what are the things that if you're looking at the best program, like these are the boxes you need to check. And I'm going to tell you about the program that checks all of those boxes. Now, in the past, you did have to go to like a brick and mortar school to learn medical billing and coding. When I started out, there weren't a lot of online options. I had to go to my local community college to get training through their business program as a medical biller and coder. And now it's so much easier because there's so many different online options available and you don't have to go to a physical school and you don't have to spend thousands of dollars in training. With online training, you can learn everything you need to know to become certified as a medical coder in as little as 6 months. A lot of these courses are self-paced, which is so great for people like new moms who have kids, or just any moms who have kids, or anyone who has a busy schedule. Like if you're working a full-time job to support yourself and you need that flexibility of that self-paced, or you just want a little bit more structure, like there's so many options available. Back when I started out, if I went on vacation for a week, I missed a whole week of school. I got maybe like notes if someone was willing to let me copy theirs or made some for me. There wasn't that recorded video or access to a recording or modules that you still had access to online. So the online training is really, really phenomenal. But the first and most important thing I want to tell you is that if you want to get into medical coding, now medical billing and coding are two separate concepts. If you want to know more about the difference between billing and coding, I actually have a video. If you see that little eye icon up here, click on that and it'll tell you. I'll also link in the description below in case you want to check it out after you've finished this video. But there is a difference between billing and coding. Billing is more so checking the claims, making sure it got paid. Coding is more so reviewing the records, abstracting all of that information that we have for diagnoses, for procedures and medications, and converting them into codes. So if you want to be a coder, the vast majority of positions out there require a credential. You have to go and sit through a formal examination process and get that credential. The most common one that employers look for is the CPC. So one of the best things you can do for yourself is find a training program that will prepare you for the CPC. The second one would be like the American Health Information Management Association has their CCS. So the CPC is Certified Professional Coder. It's coding for provider-based services. CCS is Certified Coding Specialist, and that's coding for hospital facility services. If you think kind of like an LPN, a licensed practical nurse, you can go to a college and get trained as a practical nurse and get your diploma as a practical nurse. But in order to work as an LPN, you have to go and pass your NCLEX. And once you've passed the NCLEX, then you get that credential, that LPN. So it's the same thing with medical coding. Even though you have coding training, those employers are going to look for that credential. So LPNs for our practical nursing, but for coding, it's that CPC or the CCS. Usually they're looking for something through AAPC or HEMA. There are lots of jobs within the revenue cycle or in the billing department that don't always require a credential, that they might just require the training. But again, specifically if you're looking for that title of a medical coder job, they're going to start looking for those coding credentials. And actually, there are some employers out there that they'll say, oh, well, if you have the coding training, we just want to make sure you get that credential within a year of your hire date. So that doesn't mean that you have to wait until you pass your exam to start applying to jobs. You can start applying to jobs, and they might make it contingent on, oh, well, once you're hired, since we already know you're in training, you have plans to take the exam, we just want to make sure that you pass that certification exam within 1 year. Actually, let me backtrack a little bit and talk more about what medical coding is. So medical coding, it's not a programming language. It's not like learning Python or C++. It is reviewing medical records. So you have to do a lot of reading of these medical records, analyzing them, interpreting them in a certain way that meets with guidelines of sequencing. One code goes before another. If you use this code, you don't use these 3 other codes. And that text is converted into different code sets. So we have, for example, this book is my CPT book. It is current procedural terminology. So this is for procedures and other services like your annual physical exam, or psychotherapy, or physical therapy, surgeries, office visits, all kind of procedural stuff. We also have other books. This one is my ICD-10 book. ICD-10 is our diagnoses. So there's like hundreds of different codes for different types of diabetes. We have one generic code for like diabetes mellitus, and then all of the different complications that could be involved with that. Then there's sequencing guidelines involved. So it's a big old book. You don't have to memorize all of the codes in the books, but you do have to know how to utilize the books, and you do need the physical copies of the books in order to take your certification exams. Some organizations, they'll give you access to a computer application that functions the same way as the book does, so that you can look up codes and apply the guidelines. Some companies, they will send you books. If you want to work independently, you can purchase your own books. There's actually going to be some pretty cool opportunities coming out that I'm going to talk about on this channel in regards to kind of working for yourself as a medical biller and coder. This cute book over here is my HCPCS book. HCPCS is the Healthcare Common Procedural Coding System. It's things like durable medical equipment, medications, some insurance-specific codes. So we have that book. We also have ICD-10 PCS. I only know about this much ICD-10 PCS because there are different types of coding, and the type of coding that I have done for the past 13, 14 years doesn't involve PCS, but depending on if you want to learn inpatient or facility-based coding, you might need a PCS book as well. If you take the CPC exam, you don't need a PCS book. So all of that text in the medical record is converted onto the codes. We use that not just for billing. That's the most common thing we often think about. Like, oh, we put it on the bill that goes out to the insurance company to make sure that the insurance company pays for these procedures. But it's also used for a lot of data tracking. It's a lot easier to sort code-based data than it is textual data. So say, for example, we want to look at the data of diabetic patients and see what percentage of them developed diabetic gangrene, how many of them needed to have amputations based off of that. We can look at those codes and pull the data for that code for diabetes. We can pull the codes for diabetic gangrene. We can pull how many of them had amputation codes and sort all of that data and see what are some of those outcomes we can predict. And that does things like even help us predict future healthcare costs. We can see what diagnoses patients have, what type of resources they're probably going to need in the future, and start saying, okay, well, we know that these patients, we're going to need to have this much money in like the Medicare fund in the next 5 years, 10 years, 20 years to take care of them. And of course, it's also used for processing medical bills. So if a provider is ordering an EKG, an electrocardiogram, we would expect to see that there's some sort of heart-related condition and not that the patient was having toe pain. And we tell that story, we send that to the insurance through those medical codes, so they can go, oh yeah, EKG, they had atrial fibrillation, that makes sense, let's pay it. Or, oh, EKG, they had toe pain, that doesn't make sense, send that back, it looks like maybe they made an error, or maybe the provider is not doing something right, let's take a look at that. Now, one of the cool things about medical coding is you can not only train online, but you can also work from home in medical coding. There's a lot of medical coding jobs that can be accomplished from home as long as the appropriate security measures are taken. Those security measures are determined based off of the company, but pretty much all of them have some methods that they use to protect the patient information, because obviously they don't want you sitting in a Starbucks with patient charts open and people walking behind you. So depending on your company, they will dictate what the security measures are. It might be things like you have to have a private area, so you can't be working in a common living room, even in your house with your family members going by. It could be that they don't want you taking care of elderly parents or young children while you're trying to work, because you're going to be looking at very detailed information. They want things to be very accurate, and it is productivity based. So they don't want a lot of distractions. So they're going to set some regulations to make sure that you're successful in your job working from home. Now, once you've chosen your program and you're starting training, you really have to stay focused and stay motivated. Learning any new skill is going to be difficult, whether it is medical coding, whether it is dancing, whether it is programming, whether it is engineering or computer science. Like, any new thing that you're going to learn is going to seem a little bit overwhelming at first. So you have to keep focused to get past that and understand that, yeah, we all suck at things when we first start them, but it's so cool to see the progress of getting better and developing yourself. If it was going to be super easy to learn, it wouldn't be such a valuable skill, a well-respected skill that's going to pay very well. So in addition to those coding skills, learning how to read a diagnosis and abstract it and convert it into a code, you'll also learn some billing skills, like what different claim forms are, how they are processed by the insurance. You'll learn about those privacy regulations, some compliance aspects, possibly even things like how to identify and report if you are suspecting fraud. If you hit roadblocks though, seriously, don't worry, because I am always here with tons of tips on the channel. How to code for diagnoses, procedures, exam preparation, career advice, specialty information for different medical specialties. Like, you definitely want to make sure that you hit that subscribe button and the notification bell so that you get alerts when I post new episodes, because I don't want to lose you. You need to be subscribed to this channel so that you can follow up and come back for all of that awesome information. So when you're picking your training, you have to be careful though about some of these fly-by-night programs. You'll see, like on Instagram, you'll see all kinds of stuff promoted for medical billing and coding. And some of these organizations almost seem to pop up overnight and then they're gone and you don't hear about them anymore. So look for something that's maybe through a true college, not just something makeshift online, like your local community college, something that you can verify is a true school. And something that has an established program, ideally something that at the end of it you can get like a college certificate that says, hey, I'm so-and-so and I have completed this, diploma in medical billing and coding. Or you can even go directly through the AAPC, depending on what certification you want to get. They have training available online. But again, keep in mind, even if you go through an education program and you get that certificate of completion, the end goal is to sit for that formal exam, the CPC or like the CCS, and get that official certification, that official credential, not just the certificate of completion that your online school will give you. So if you want to work in the majorly growing, highly secure healthcare industry, but you don't want to deal with patients, medical coding is an amazing option. So what are you waiting for? I definitely need you to check the link below for my masterclass. You can sign up there to find out all of the great information about online training options. And if you just want more information, you can check out this whole playlist here on information on getting into medical billing and coding, things like salary ranges. But yeah, that masterclass, you can't beat it. I will see you guys in the next video. And until then, just keep on coding on.